a very good virtual experience. So really, in that way, again, the doctor does not need to leave Kampala. The patient doesn't need to leave Tororo. The two will be able to interact, and they will get a consultation. So that is the idea of the NetDoc software. All right, so on your screen, that's the picture of once you download the app. That's what you've seen. There's been a video playing that I guess by now you know. So that's the first platform. We call it the patient mobile platform. They download on their phone. Then the second one is the web-based doctors platform. That one is how it looks like. And then the last one is the hospital platform. That is where the customer team, the relationship managers, and the admins, that is where they sit. So those three interact to bring out this experience we call telemedicine. All right. So ideally, our key features, one is video consultation. You can do video with your doctor. The doctor sees you, you see the doctor. But someone told me, how about if I don't like video? No problem. If you don't like video, we use the local call, then you'll not be seen. Then we have the AI model. By now, I know you hear this craziness of AI. We said in the beginning, we've gone to the future. So we've incorporated AI model that works as a doctor's aid to turn any average doctor into a distinction doctor. For example, once you have booked an appointment, meaning filled a form, and you're ready to see a doctor, the doctor will simply use the AI to be able to take your data through an algorithm that will show him that the most likely diagnosis is malaria. It's not typhoid. We'll show that malaria is 80%, and then typhoid is 40%. So he will direct his examination on malaria, not wasting time thinking this could also be typhoid, this could also be this could also be this. That's where our AI model, and by the way, we developed, it's an in-house AI model. It's not something that we bought from somewhere. And then I've talked about the chat, that is patient to doctor. You can be able to chat with your doctor all the time, just like you chat on WhatsApp. Then when the doctor feels the doctor who calls you, you cannot call the doctor, but you can chat with the doctor. In that we don't want it is 4 a.m. and you're just picking a call saying, you know, how are you, doctor? And say, is there any problem? No, I was just checking on you. No. So you can't call the doctor, but the doctor can call you. After the chat, he feels that, okay, based on how things are going, I need to hear more from this person. Then SMS alerts. Whenever you get communication from us, you'll get an alert on your phone. And then I've talked of the voice call. In case internet is misbehaving or the video is not working, we use the voice call with the doctor. Then the patient-doctor email service, 98% of your communication is through your email. And then medical history records management, I've talked about that. The doctor-patient follow-up portal, I've talked about that. Then pharmacy portal, this is once you're ready for subscription, for prescription, I mean. Then what happens is doctor initiates the prescription. Then the partnering pharmacies are going to be able to get your prescription on time, and they'll be able to serve you without leaving your home. All right, so those are our key features. So quickly, if you see that, that is what we do, find and book appointment quickly with your doctor, be able to access all, you know, your medical records anytime. We talked about that. I think I don't need to repeat that. So the next one will then, thank you. All right, so let me finalize with this. When we talk about NetDoc with a K, basically we are talking about two major products. We are talking about the NetDoc app that so far you're aware that is you accessing healthcare through your phone with a consultant or a doctor. Now, that is our first product. But our second product is what is referred to as NetDoc Prime. And NetDoc Prime, this is where the existing specialist clinics and hospitals can actually use our platform or use NetDoc platform to power their system so that they can also use telemedicine to see their patients. Remember, I've been saying that we are a system. We are not just a virtual hospital, but also we are a system. So, for example, we have East African Medical Center right now with us. It's an Iristian hospital. So East African Medical Center, once you go to NetDoc Prime, you'll be able to access East African Medical Center without you going there physically. And that's the vision, that all the hospitals in Uganda can be able to upload their system or can be able to use the Prime to see their patients so that the patients do not need to move, as in to use telemedicine that I've been talking about. In that, I believe we shall hit the 75% European record, that indeed 75% of the clients across, or patients across the country, see their doctors, see their specialists, receive consultation through telemedicine. So those are our service partners. In doing this, definitely you ask yourself, how about if I want to do a lab? Yes, we've partnered with all the major labs, and we are onboarding as many of them. Lancet is there, C-Lab is there, Same Day is there, MildMed is there, LMK is there. We are onboarding as many of these labs as possible. The same with imaging centers. So in case the doctor feels there need to be more investigation, sends you to do more, maybe a scan or something, we are partnering with these imaging centers to make sure that happens. And then finally, pharmacies, we are partnering with the pharmacies to make sure that you get medicine. So the whole idea is you don't leave your home, you don't leave your office. This, apart from imaging centers, because they can't bring the machine to where you are. The scanning machine can't be driven to the office. But with labs, the guys will come and take your sample from your office. They'll take your sample from home. The results come back. It's wired to your email. It is integrated with your doctor. Your doctor interprets it, shares for you the result on your email. If he needs to throw more, he will give you a voice call to explain to you the result. Everything is done without you leaving where you are in a record time. Record time. We are talking about below 1 hour. The whole process, interacting with all these different, apart from the some different tests, may require more than 1 day. So, but the obvious tests, we are talking about within 1 hour, you are sorted. So to do that, that's why you have those auxiliary services to achieve that. Then, of course, my last one is just, if you look at, that's our team of in-house doctors. We have, led by Dr. Wilbrod. We'll be able to hear from him shortly. And then we have Professor Pauline. Most of you, I think, may have know about her. We have Professor, yes, there's Dr. Agenda, there's a number of them. So, but on top of that, we have, we are currently, I think, we are entering 30 specialists who are ready. They are being onboarded, ready to use our platform. On the 10th and 11th of November, we are going to be at the doctors' conference, where there are over 600 doctors. We are going to be sharing with them, and we expect from there to have more than 100 specialists on the platform. So all your specialists, I am sorry to mention, but people like Dr. Businje, you'll not need to be able to go there physically. The Dr. Mwanje is for the ladies, and the rest, we are already in talk with them, onboarding them to be able to have, to use the platform. So ideally, that is the NetDoc with the K, Medicare, as a company, that is what we are presenting the country. As I started, I will close with this, that there is no way our country can move forward without the media. And that's why we thought that as we are launching the Go, the Healthcare on the Go campaign, the best place to start with is to start with you. I will again say I'm so humbled, and as a team we are so humbled, that when we send the request, you massively accepted, and you are here with us this morning. Once again, allow me to thank you in a very special way for doing that. We have no doubt that going forward, we're going to go to questions and answers. We're going to be seated there to receive all questions that you have, so that you live here to be the mouthpiece, to be the preacher who has all the message necessary. So thank you. Thank you once again, and we look forward for deeper conversation.
Thank you very much, Richard. Thank you. When we started, we introduced ourselves, and I'm very sure that you now know all of us. Everyone who's wearing On The Go T-shirt is NetDoc. So on the other side, our guests, you are the journalists, and would like to know who you are. It's not, you should have told us before, but I intended that so that we were all busy. So we already know ourselves on this side, you know us, and now would like to know each one of you. I'll pass on the mic, and then you introduce yourself and the media house that you're representing. Okay. Okay. I think let's start from here.
Thank you. Good morning. My name is Sarah Chen Kibisi. I contribute for PML Daily. I want to thank Mr. Richard for his presentation. But my question is, you hinted on the issue of the app being developed. Sorry?
Okay, let me just make it clear. We are introducing ourselves on this side, and then the questions are coming. Okay, thank you.
Good morning, everyone. My name is Kwagala Shifra. I'm here. I report with Chimp Reports.
Good morning. Samla Hanifa is my name. I report with, I work with Smart 24 TV.
Good morning. Namiganda Jael. I work with Metro Radio.
Good morning, everyone. My name is Zainab Ali. I work with Galaxy FM and Galaxy TV.
My name is Wycliffe Sebunya. I work with Radio 1.
Good morning. My name is Moses Indai. I work with KFM Radio.
Good morning. Deo was my name. I work with Capital Radio and Beat FM.
Good morning, ladies and gentlemen. My name is Baz Waiswa. I work with Chama News.
Morning. My name is Ruth Adong. I work with Sanyo FM.
This morning, everyone. My name is Geoffrey Serugo. I work with The Observer.
Morning. I'm Ronald Kawiye. I work with Trusted News Uganda.
Good morning to you all. My name is Jen Nafula. I work with Daily Monitor.
Good morning. I'm Nixon Segawa. I work with UG Standard.
Okay, thank you, everyone. Now we go on to our next item, which is the Q&A. I would like to invite our team over here to answer the questions. There are some of the questions that are addressed to, that medical questions will be addressed to our doctor who will be with us online, and they will be answered later, so we'll just take them up, note them down, and then they will be answered later at the end of the physical Q&A. So, Brenda, Emma, okay, I think she had the very first question. Let me...
Thank you once again. My name is Sarah Chen Kibisi. Like I said, I work with PML Daily. Mr. Richard said that the app will help the upcountry people, like especially those who have to travel from their districts of abroad, like for example Tororo, to come and I don't know, they'll be able to seek medical care online. But I'm just wondering, most people upcountry do not own smartphones, so how is this going to be helpful to them? They don't have to travel and come to Kampala for treatment. Thank you very much.
Let's take a number of them, and then not all at the same time, but quite a number of them, and then.
Good morning. My name is Flavia Nasaka. I work with Uganda Radio Network. My question is on, you talked about having partnerships with regional referral hospitals, but we know many of these have not fully embraced telemedicine. We would like to know how exactly you work with this. Is there a partnership that is formal with the government to do this? Also, you talked about, you said uptake of telemedicine increased globally. I think you were giving a global picture during COVID-19. And this is the time, around the same time NetDoc came in, because you said 2021. I would like to get a picture of how the trends have been when you came in at that peak of COVID-19 and how it is doing now. Yeah. And finally, it's on AI. You said your doctors are employing AI in Medicare. How exactly is that being done with the precautions that we got from WHO on AI in medical care?
I think that is a question to a doctor that will be answered later. I hope we've taken note of that.
I would suggest that before we are overwhelmed and we show it as it comes. Yes. Let's, for example, now we are at 4. We would answer this. Then, hopefully, in answering this, the other person's question is also answered. Are we in agreement? All right. So, first, AI. We have the IT here is going to definitely answer that. I will answer the first one that was asked by Asheng. And you said upcountry people do not have smartphones. Now, first, I think it's not true that upcountry people don't have smartphones. I'm on social groups with my aunties, uncles, and we are online all the time. I may say that yes, not all of them, but you see the idea is this: when you're developing a product, you start with a specific target group. And yes, when NetDoc was being developed, and our concept works best with people with smartphones. But that's not where we are ending. Of course, now after serving them, we are then going backward, and that's why we've incorporated, I talked about the voice calls, where they can be able to call. But however, the NetDoc model, 90% serves those with smartphones. But then we are now going backward to incorporate the others. So in developing this, we started with those with the smartphone. And by the way, statistics-wise, show it, we are more than 10 million Ugandans actually on this smartphone. So the second one, you ask about the uptake of the trends so far, the fact that we started during COVID. I'm glad you brought up that question. Yes, we have been in existence for 3 years, but these 3 years we've been developing the software, testing the software, having all the certifications, making, because if you apply, for example, to NITA, doesn't mean tomorrow NITA is going to give you the certificate. They're supposed to make sure that your systems are tested. They're supposed to make sure that what you're talking about works. So all these different stakeholders, and also us ourselves, we did, for example, a test run in Makerere University where we had hundreds of students use our application at the same time to just test it, to try it. We finished that phase. We came and launched out to the general public where they were using it for free to still test out. That was the pro bono launch or the pro bono phase. After that, around 3 months ago is actually when we went live. So starting to have patients, that is 3 months ago. I am glad to say that the population has received this. A lot of people have downloaded the apps already, and that is why we are all having this conversation. Because the biggest thing, to be truthful, has been the mindset shift that I guess the media is going to play a big role to make sure that they understand, or the population understands, that telemedicine is actually not different from that physical visit. Then that will bring me to the last question of how we're partnering with regional referral hospitals. Yes, we are right now engaging with Ministry of Health. We've so far had 2 wonderful meetings with them. We are having the 3rd. We are supposed to do 6-level meetings with Ministry of Health, so that at the end of the day, we don't just come up with a policy of telemedicine to govern the country, but we are also going to look at, the conversation is how do we utilize their bases, like, the district health officers, the regional referral hospitals, the district referral hospitals. So right now we are having engagement with Ministry of Health. At the end of the day, we shall, once we are done, I will be in position to say yes, the regional referral hospitals will be integrated. Because I mentioned the NetDoc Prime, where hospitals, currently private hospitals, can actually use our platform to be able to offer telemedicine. The same concept will work for public hospital, but that conversation will come when we are there. We started with private, government, we're in conversation with them. The last question was AI, how we've modeled it. I think our IT person can mention that better than I can.
Yes, Richard, thank you very much. I don't know if I'm audible. It's like I'm hearing echoes. Yes, so with the AI, if at all you look at our algorithm, the patient fills in the form, and it's that information that the doctor gets, and he reviews the information of the patient. So what AI does, I don't know if you've gone to a hospital and you literally have to do over 7 tests. The doctor will tell you go for urine, go for probably X-rays and all that. So what our AI model does is it zeroes down on the test that you're supposed to do. So so that will help the patient to reduce on the costs, because you would probably go to a hospital, then you probably spend over 500,000, but you find out that most of the tests that you've done are negative, and your money has also been spent. So with our AI model it zeroes down on the test that you're supposed to do, hence saving costs. I hope that answers your question. Thank you.
Okay, thank you, Richard and Emmanuel. Let's take on some more questions.
My question is to Mr. Richard. What is your country's coverage? Have you reached all the districts in the country, or is it just specific districts that are covered? And then how is its recipient in regards to the urban compared to the rural areas?
Thank you. Good morning once again. My question is, in terms of payment, how much? Because you've not told us the payment. Is it affordable for all Ugandans? I'm talking about the Muntu Awansi. Do they pay for consultations only? Consulting a doctor? Do they pay just consultations? How fast can I access the medication or the services? If I'm not able to leave my home, I want this mobile, this telemedicine to get to my home fast. How fast can I access it after calling? And who pays the transport cost and whatever? Yeah. Thank you.
I don't know whether you've answered the question. It was raised earlier about the figures in Uganda. The ones you gave, I don't know whether they were international figures, about 30 to 60% telemedicine utilization, dropping to 15 to 30%. Was that an international figure? And could you paint us a picture of the local figure? And there's this notion that when you see a doctor, they touch you, they talk to you to get the feel of your ailment amongst the population. How are you addressing that?
Okay, I guess that was direct to a medical practitioner, and a doctor will be online to answer that. Oh, okay.
Hi everyone, my name is Violet. I work with New Vision. I'm sorry I came in a bit late. So my question is, why are you coming up with this innovation? As in, what are you trying to achieve? And are there any restrictions on who can prescribe?
Okay, thank you. I think even that question, the one that has just been asked, we'll leave it to our doctor online, who is also the CEO and the vision bearer. So he'll give you a brief on how it all started.
Okay, thank you. Nixon Segao again. I work with UG Standard. I would like to understand, does the app also provide the details for the doctors? Do I have a choice to choose which kind of a doctor or a specialist that will work on me, or I only leave it to you guys? As long as I state what I want, then you figure out who will work on me. Then again, when we talk of the appointments with the doctors, will I specifically be having one doctor who will work on me, or you'll be choosing at whichever time you want who will be working on me? Because you talked of all the details being available. So does that mean whoever doctor jumps on your form you can consult with that doctor on that day? Thank you.
All right, thank you. As Barbara made it clear that shortly we shall be joined by our CEO online, and of course our concept is online, so he'll be joining us online as our doctors are working and serving their patients wherever they are, but join us to answer some of the questions, and some of the questions going to be answered by my team here in front. So I will pick up the first one, which is the issue of the coverage. And how is it's being received urban versus the rural thing. First, that our approach of marketing has been digital. So it means we run ads on all the different social media platforms. And these ads are not only to Kampala. In fact, I can say yesterday we had a client from Gulu seeking out, I think he was a tourist or so in Gulu, seeking out a specialist. So how did he know about us? Through, of course, the ads that we run. So our campaign, and with the Go campaign, it is countrywide. But then, of course, the billboards and the rest, yes, we started with Kampala, and soon with the Go campaign, you'll be able to see healthcare on the go across the country. How it's being received, of course, our data, in our database, we have tens, I think we have quite a number of downloads so far. But as we say, being a new innovation, being telemedicine, we can't say that we've been sloping on the mountain and all just rejoicing. There's been an uphill task of educating and offering leadership to our countrymen in terms of health, that this can be done, this is possible, this is legit. The world has been there already, is already ahead of us. We need to catch up with the world. And so we are doing the marketing, we are doing the mindset shift. Then the other question, as the issue of payments, how affordable is it? You see, when you talk about cost, in our view, it's not the money you pay for consultation. The cost begins when you leave home and then you jump on a border, or you use the taxi, or you put your fuel to go to the hospital. It does not just stop there. It also involves the time that you are substituting for the other thing you're supposed to do. Because if you leave your home to the hospital, let's say it takes you 1 hour. If you're in Kampala like me and all of us, it'll take you 2 hours. Then you reach there, you spend maybe another 3 hours. Those 5 hours, that's a big cost. So when I answer the question of cost, I don't believe cost is the final figure you pay to the doctor. Cost is an all-encompassing figure that involves your time, the other costs like transport and the rest. And this is what we are saving. This is what we are saving. So for me, the question is not, is it affordable? Because I can guarantee you 100,000 is affordable, just like 50,000 is affordable, 10,000 is affordable. So what is affordable? What is affordable? What I'm trying to say is these are what we are paying out. We do not have one figure in the country that now we are benchmarking on that. I mean, different hospitals and different practitioners charge differently. And what I can guarantee you that with telemedicine, the cost from all angles, including the one you pay the doctor, has been subsidized and it's made cheaper. I will let Brenda answer the issue of okay, just to hear the lady's voice, I want to give her the microphone so that she answers. NetDoc is not for men only.
Okay. Okay, then I'll answer the gentleman who said why this innovation came up and what we achieve. This innovation, telemedicine, is the future. That's where the entire world is heading. You know what happened, how COVID struck, and how people are very busy. Everyone is busy. People are into something. People are traveling. So you need to have the hospital. That's why we have this campaign on the go. Your hospital is on the phone. So this innovation came up. Actually, there is a story of the vision bearer. Richard will give us the story of how he came up with this innovation. But for we Ugandans and the rest of the nation, we need to have the hospital in our phones, just like you have those applications that save you. You can't afford to be sick at night and you wait till morning to move to the hospital or get a taxi or a boda. But you have a hospital. This hospital is 24 hours. And the other thing that he said, what we are achieving, of course, we are saving lives. The turnaround time, you can't guarantee what time the doctor is going to touch you when you go in the hospital or you're going to find him there. But once you have this application on your phone, you are saving time, you are saving money, because cost, he said, the cost begins when you jump on a border, the consultation you pay, going back, the time that you spend in the hospital. So we are saving time and we are saving lives. Back to Richard.
Maybe I'll just answer my brother's question here before. He said, is it us who determine which specialist or which doctor? So there are two categories of people who offer health care to the population through this system. One are specialists, one are the general doctors. Now the general doctors are our in-house doctors. These are general doctors. And so with that, it's not you decides, the general doctor who sees you. But also after he has seen you, he's the only one going to handle you within that period. Does not mean that now we attach a doctor to you and say forever, this is your doctor. No. But once you've seen Dr. Richard, for example, and for the next 14 days, by the way, which is another important thing, our follow-up for free is for 14 days. For the next 14 days on that condition, you will be managed by that doctor and you'll be interacting with that doctor. But when it comes to specialists, it is you who chooses your specialist. And this will give me the opportunity to answer the issue of the costs. You know, the specialists, we give them the platform, but these guys charge differently. For example, the specialist A, he can charge 150,000. Specialist C is charging 50,000. Specialist D is charging 40,000. So it is not us who determines. We don't come and say, hey, you know, you must charge. No, we give them the platform to be able to meet their clients. So the same way you've been going to specialist A, maybe at this hospital, is the same way you're going to see him through our app. So in specialists, you decide you are a specialist. And still, maybe I use that opportunity to say again, specialists, we have two kinds. We have the in-house specialists. Those are the NetDoc, because we couldn't start a hospital just relying on, you know, as an assumption, we had to have our own specialists. So we have our own specialists, but then we also have these over hundreds of specialists that we are onboarding them. I did mention we're already at 30-something. We are targeting by the close of the year to have more than 100 specialists. These are different specialists. You know them. You've been going to them. What this system will offer you is you don't need to leave your work. You don't need to leave your home to be able to see that specialist. So at this moment, as we did mention that we are going to have a brief answer from the CEO, that's Dr. Wilbrod, may take us in details on some of the questions, including why he came up with this software, and then also on how the AI and whatever that we've not answered, he should be able to answer. As that is being set up, waiting to see him live, the lady from New Vision asked a broad question that I had attempted to answer earlier on in my presentation. Why NetDoc? I talked about our current state as a country, the doctor-to-patient ratio, how it is way lower than what's being recommended. I talked about the fact that we are looking at leveraging specialty doctors where you don't need to leave your home, especially taking them to rural areas. I talked about the fact that turnaround time, we are going to reduce the turnaround time. So to my colleague from New Vision, yes, NetDoc is coming as a platform to change and to involve all players in the health care model. We are talking about pharmacies, we are talking about imaging centers, we are talking about laboratories, we are talking about consultation doctors or specialists. So all these people are put in one platform to offer you the best affordable, best I mean in terms of quality, but also affordable without leaving your home or your office. So in a nutshell, that's how I can balance that question.
Okay, thank you, Richard. I think one of us asked about the figures of 60-something, and she asked whether it was a global figure or it's a Ugandan figure. So could you please answer that?
Thank you. Yes, the figure I quoted is on global because we do not have statistics locally. So that's on global. And I did mention that when COVID happened during that time, it went up to 60%, came down, but currently it's between 15 to 30%. But as far as locally is concerned, first, we don't have the figure, and we are not the only players. So we need another high authority to give the overall figure. But what we can say is the recipient, especially from the population, has been so good, and that's the reason why we are here, to make sure the curve goes even higher. And the issue is this. I'll be forced to put it this way. You see, we are offering leadership, and what leadership does is you take people to where they have not been. You see, so we are taking people, we are answering up all these questions. Can this be possible without physically touching? Our CEO is going to answer all that. Okay, but we are used to ABCD. He's going to mention all that. So we are now shouldering this burden to make sure we increase those statistics. So we are not relying on the statistics from out to inform what we are doing. We are saying we are going to create the statistics. So we have a target. That's why we are launching Healthcare on the Go. By the end of the campaign, we want most Ugandans to know that this option exists, but also to see it as the obvious option. You're already ordering food online. You're already ordering, transportation online. You're already ordering a lot of things online. Why not also be able to enjoy healthcare online? This is not a Ugandan concept. Internationally, it's already happening. There's nothing we are doing new. We are simply bringing the innovation home. So telemedicine is not just a NetDoc idea. It's a global idea. Doctor on the Go is there, as in First Doctor is there, Cree is there. Countless companies are there already offering. In fact, before COVID, it's not actually during COVID, Cree started in 2013. So they have been around. So this is the time we are saying Uganda too must be on the global map as far as telemedicine is concerned.
Thank you very much. Thank you. Any person who feels they still want to know something? Okay.
Hello. My question is about data protection. How are you managing data protection for your patients? And because this service requires exchange of information. If someone's information is leaked or disclosed, how do you manage data protection? And do you feel that in Uganda do we have good laws in data protection? Thank you.
Okay, thank you. I'm going to add part of that, and then Emma is here will answer part of that. In my presentation, I mentioned that we currently have 5 certificates locally from NITA Uganda. They are the ones in charge of information. And I guarantee us they have more interest because they are the one mandated to make sure that your information is not shared by any third party unless you give them the permission. But also, on top of that, our system is built in such a way, the word I said earlier on, which I said I've suffered with it for the last 3 months. Emma is going to help me answer that. The communication between you and the doctor, that information only goes as codes. So it's not recorded anywhere. It's not uploaded anywhere. In between as codes. But in a technical language, Emma is going to be able to explain that.
Thank you, Richard. And I think you need to break it down for him that the 2 certificates, not just mentioning who is actually giving them to you, but you break them down, the 2 of them from NITA, and then...
Yes, so maybe let me just try to answer that. So NITA, an organization for data. It has two certificates that it offers or it issues. One is the personal data privacy certificate, and another one is for, I think Richard will help me on that. But then again, we are also certified by Apple and Google, because for you to push an application, you have to first go through a lot of stages, especially if at all you're dealing with people's data. Google as a company and Apple as a company are very, very strict, and we are like Richard presented, we have all these certificates. But then also on the word that was defeating him is data or patient's information is not just transmitted via text, like the way you would text your person on WhatsApp. It's encrypted. So data moves from the patient's phone to our side encrypted. So a person will just say hashtags and probably full stops rather than the raw text. In simple terms, that's how I can explain it. I hope that answers your question.
Maybe I'll just throw something. You know, as a company, as business, we came in business. It is in our interest. I believe now we've invested not just time, but millions of dollars to reach where we are. We wouldn't want any gap, especially when it comes to patients' information. We would put our neck to make sure our system is, of course, we know the world of hacking and all this kind of thing, but we also got a certificate from a top hacker who does the hacking for camp to prove if your system cannot. We have a certificate from him. He gave us a go-ahead because we needed to build something that will allow us to stay in business. I can guarantee you that we shall be out of business the moment when your information leaks outside there. So rest assured, let the country rest assured, let the people rest assured their data are protected.
Any more questions before we go live? Oh, there is one here.
Yes, there's one question. In a few minutes, our CEO will be wrapping up our meeting. So as soon as he gets online, we shall turn the mic to him.
Yes, maybe I would seek more clarity on the efficiency and the capacity, because we may soon be receiving messages that all our doctors are currently busy. Please stay online. So how are you going to manage? How fast do I expect a response when I log in to consult? Thank you.
Beautiful question. You see, our platform can carry endless doctors. Just imagine endless doctors. That's one. So we are not talking about after 50, we say, please you serve until you bring the 60. No, we can have 50,000. We can have 100,000. So as demand increases, so do supply increase. We are onboarding these doctors day and night. As we said, specialists, at the end of the year, we need to have over 100 of them. So demand is definitely going to drive that. But the platform we build can be able to carry endless doctors. And just to put another perspective, currently we have 4 major languages. So I'm glad Luganda is up, right? Luganda is up, so we've translated the app to Luganda. Swahili is up, French, Arabic, then we have that Tigrinya for Eritreans. So we are not just talking about Uganda, we are talking about the region. So to think about that, the first question we answered was capacity. So since it is a web-based system, I can guarantee you, bro, as soon as you be able to book appointment, and that is why when we explained, I said we have 3 platforms. On top of the doctors, we have the non-clinician platform, which is the hospital platform. They are seated simply waiting, and not just sitting, they have notifications, everything. As long as you book, they get a notification. Someone has booked, it's being assigned. In fact, in the night, the system is automatic. You are assigned to the doctor who's live automatically without even passing through this customer service and all this. We are doing that to make sure that conveniency is about time factor. So seeing a doctor is as soon as you book. Yes, thank you.
to be, we already have a problem of moonlighting, where we see a doctor in a government facility working in 7 other private hospitals, and this app is promising us 24/7 coverage. How do you sieve or analyze the doctor to add on the app?
Okay. First, we are looking at being effective. You see, in this doctor who's moonlighting, by the time he travels from Mulago to another place, he's losing how much time? There is off service. You look at even the specialists themselves. But also, we are looking at, so in this case, he has his laptop, that is all he needs, or yes, his laptop, that's all he needs, and he's able to serve you as soon as you log in. So we are looking at being effective with a few resources, because there are 2 options. If you cannot increase the resource base, then you must be effective with the little that you're having. And that's where we are coming in, that he is effective with the little. We are effective, we are leveraging to make sure that the few specialists are accessed across the country, but these guys don't move up and down to lose time, but also they can, from maybe their homes, they can work longer. Let's say as a doctor, by 6 I'm at my home, from 6 to 10 or to 11 I'm actually serving people. That would be hard if I'm serving from elsewhere, I'm then supposed to drive home. So it's basically being effective with the little resource that we have. I'm glad to note that Dr. Wilbrod is online. Dr. Wilbrod, I hope you are hearing us. So Dr. Wilbrod is the CEO, is the vision bearer. So above my words is going to be able to answer some of the questions that we raised, and that's the aspect of touching, physically touching doctors, touching patients, I mean. How do we work around that? And then the other idea, why the app? Why did he come up with this, the innovation? So Dr. Wilbrod, just to give a context why we have him online, is a Ugandan but practicing in Sweden, and so he couldn't be with us, and that's why we thought it would be important to still have him. Yes, Dr. Wilbrod, are you getting us? Dr. Wilbrod, you're muted. You are muted.
I'm not muted. You can't hear me?
Okay, we can now hear you. You are welcome. And yes, I hope you got our questions. We have 2 major questions. One is, why did you come up with the innovation? But 2 is the idea of doctors having to touch patients physically. How do we go about that, and how is our app working on that?
Yeah, thank you so much. But before I answer the questions, I would like to thank the entire team for the launch program. I just want to make a comment that healthcare is not a luxury, it's a right. And at NetDoc, we believe that we know that there's been a gap when it comes to medical service provision, and this is where NetDoc comes in to fill up that gap. We know that so many of our relatives, so many of our brothers or sisters sometimes have difficulties when it comes to accessing quality and timely medical care. We've witnessed cases where people die, or people die unexpectedly, or people fall sick and cannot quickly access medical care for something that would have been avoided. Now, this is where NetDoc comes in. I think the first question was about what prompted me to come up with this software. I want to say this is something that has been fairly personal to me and to us as a family, where we lost our dad to can you hear me?
Yes, as you can.
Yes, where we lost our dad to heart attack, the type of heart attack we got was a type that could have been easily treated. I'm a physician. I'm a consultant physician here in Sweden. I've worked for over 25 years. So I know that certain types of heart attacks are not like a death sentence. But in our case, he wasn't able to get that timely service. Now, this prompted me to think of some better way that people can actually access medical care. And 3 years down the road, we have NetDoc. So we are proud to be launching NetDoc. We are proud to be presenting NetDoc to everybody. It doesn't matter wherever you are, doesn't matter what time of the day, should be able to access medical service through our platform. There was a question that somebody had posed earlier. There was a question someone had posed earlier, but before I was called in to go and respond to a patient. And somebody was asking, what do we do? I mean, there are patients up country. I think Richard had presented about the up country patients or up country users, where not all of them have access to smartphones. Yes, this is quite true. But I don't know if Emma has covered that, because our software allows users to be able to share their accounts with their relatives or their neighbors. So like if your neighbor has a smartphone and you don't have a smartphone, and you know that the NetDoc is there and you would like to use it, or if you know that your aunt doesn't have a smartphone and you are with your aunt in the village, you can actually connect with one of our specialists in Kampala or wherever, so that your auntie or your grandma can actually be attended to without having to leave her home. Now, I don't know, Richard, I don't recall the other second question. The second question which had been presented to me.
Is the question of the patients the doctors having to physically examine the patient in order to make a good diagnosis.
Yes, thank you. As when I was training in medical school, we were being told that to make a diagnosis, you need to have a good history, perform physical examination, and perform imaging or perform investigations. What we've learned during the COVID pandemic is that you actually don't need to be with somebody in the same place at the same time. We know that with a very good history, you are almost 90% able to make a diagnosis and right diagnosis. Now, this is where we thought of NetDoc, where the patient fills all the information about him or herself that he or she wants the doctor to know. Most of the time, or some of you could have visited doctors' clinics or hospitals, and have come out wondering why the doctor did not ask you certain particular questions, or may forgot to ask you. So what we've done with the platform is that we want you, the user, to be able to give in as much information to the doctor as possible. So this was by design, so that the doctor feeds in as much information as possible, so that just with that good history alone, the doctor should be able to come up with a good diagnosis. Now, there's a question which was asked about artificial intelligence. Now, the AI module is going to refine that history for the doctor. So it becomes an aid to the doctor to refine the history. So instead the doctor thinking about 10, 20 different diagnoses because the patient has booked in because of a headache or abdominal pain, the AI module refines that to just 1 or 2. Now, the need for physical examination is not always the case. In my so many years of practice, there are times I don't even touch a patient. I just look at a patient, so we just talk, sometimes even on phone. We just talk on phone, and I know that what we're dealing with is maybe a cyst in the abdomen and not necessarily a tumor. Or maybe a chest pain caused by maybe a fluid in the lungs and are not necessarily a tumor. So most of the times, the 5% need for physical examination is going to be compensated for by good investigation. Now, the good investigation here, this way again, AI comes in. So the AI is both for the filtering of the history and for refining the need for the right investigation, so that makes it cheaper for the patients, timely for the doctors, and reduce the time we spend on doing so many investigations that most of the times are not necessary. But sometimes we do this because you need to have a starting point, so that you know the patient or the user's basic function or basic status.
Thank you. So as you're online, maybe we could still take more questions since the
I
CEO is
think
with us.
That's it.
Do you have any question? Oh, we're good. All right. So, Doc, we are good. Thank you so much for sparing your time amidst your busy schedule to definitely answer some of those questions that we couldn't answer. So, ladies and gentlemen, I think our part is over. Back to Barbara.
Yes. Thank you very much, Emma, Richard, and Brenda. Thank you very much, the team. We have come to the end of the Q&A and would like to thank you again and again for coming. And right now we'll have the radio people, the ones who want to do interviews on the side. Please, this is the time. We have come to the end of the function and would love to say thank you, thank you, thank you.
Okay, all right.